Good afternoon, guys. Thank you for taking the time to come and listen to me, Robert Sullivan, giving you yet another waffle. Today is the first in a series of lectures that we're doing through Aconia. The first lecture is basically an introduction pretty much to non-thermal low-level lasers, and we're going to look at how in reality over this lecture series that we can, I suppose, unlock and release the potential of these extraordinary devices. The second lecture in this series is going to deal with the theory and practicalities of cellular interaction when it comes to using these devices. So in that lecture, we will give a little bit more detail to cellular, muscular, and nervous interactions. The third lecture, then, we're going to take a closer look at how we use these lasers in clinical practice, as well as the family of lasers that we have. So if you look to your right-hand side, the panel in front of you, you'll see a panel, and on that you will see a tab that says questions. So if you have any questions throughout this, please feel free to type them in there, and I, with the lovely assistance of Julie, will get to those questions at the end of the lecture. So from the top, what we're going to do first of all is we're going to look at what is a non-thermal low-level laser and explain why we're calling it a non-thermal low-level laser as opposed to just a low-level laser. We're going to move then from that onto lasers in modern therapeutic care, and later on in the lecture we'll talk about areas where this can be applied in care. So then we're going to look at applications, benefits, and contraindications. Like every modality, there are contraindications, and then we're going to spend a little bit more time as we move through. Let me just get this out of the way. As we move through, looking at what the scope of these things are and how we can engage them and use that scope to the best of our clinical ability. So I am having issues here, so let me see if I can find the next slide. Okay, so there we go. So what is a non-thermal low-level laser? So, sorry guys, just give me a second there. So what is a non-thermal low-level laser? Basically, it's a device that applies light or delivers light to the body. And when we talk about low-level lasers, I'm splitting this into two, and I'm taking the low-level bit first. So when we talk about low-level, we're talking about a device that generates a stable laser beam from 1 to 500 milliwatts of energy. When we talk about Aconia's family of lasers, we're talking about devices that kick in around 2 milliwatts and go around to about 21.5. And when this stable laser beam is produced, we pass energy down that beam, and this energy is in the form of light, so it's hertz. The main difference with non-thermal lasers is they don't have a particular target. When we generate a laser beam, we're generating pure energy. And as you may remember from physics, once you generate energy, that energy cannot be destroyed. So when we generate this laser beam and we shoot it at you, effectively this columnated, coherent, monochromatic, stable beam keeps going. We then piggyback onto that the photon energy, which has the interaction with your cells and creates that therapeutic event. And what we're actually doing is we're talking about visual light that comes from the visual light spectrum, which is basically for most of us humans from 400 to 700 nanometers. Some of us can see below that, some of us can see above that, or some of us think that we can. And when we talk in terms of a nanometer, we are talking about the distance that light travels in a second over a centimeter measure. So as you can see from the bit that just came up, it's quite a big distance. So when we think about how this works, I'm going to really get into this next week, but just briefly how this works. So as you can see there, we're shooting a red laser beam at some tissue. And as you can see, that laser beam is penetrating the skin and it's delivering that photonic energy. Here's a good point to explain the difference between a non-thermal low-level laser and an LED. If you look at the picture there, you can see that the laser beam is penetrating the skin. So that laser beam is going through the skin, and with it, it's carrying this photonic energy. So now think of a blanket over that piece of skin. That blanket is kind of your LED. So the light is basically on the surface of the skin, and it's basically having an effect to the surface. So LEDs are very effective in some of the skin conditions that we would see, like psoriasis, eczema, etc. But these lasers are also effective. So that's the primary difference. So when we talk about these non-thermal low-level lasers, we're directing the beam into the cell. It's coming in contact with the mitochondria, and it's very interested in cytochrome C, which is our primary absorbing chromophore within the mitochondria. And as you'll see next week, that has a very, very profound effect. But basically, it's creating electron transport. It's creating a chemical event that leads to upregulation of genes within the interleukin series. It leads to emulsification of fat when used in particular ways. And it also works in wound healing, wound management. It's even so clever that it can make your nails grow more quickly and can degrade fungus. So laser is very much like any drug in its mechanism of action. So I think the drug that most of us are very much aware of is this lovely stuff called paracetamol. And if your patients are like mine, they kind of think, Rob, can I have a proper painkiller? Why are you giving me this paracetamol again? And the answer to that is it's probably the best pain medicine that we've got, unless, like me, you have a laser. Then you have better pain medicine because you can have all of the benefits with none of the metabolic issues that we have with first and second pass metabolism when it comes to paracetamol. So the laser, like a drug, it recognizes and it reacts with our molecular receptors, in this case, cytochrome C. It activates, as we already said, a secondary cascade within the cell. And it also affects the way that these cells then behave and the way these cells function. So pretty much the same mechanisms as you'll find in most drugs. And our example here, of course, is paracetamol. When we look at cold lasers, non-thermal low-level lasers, it's the same thing. We also have to look at hot lasers. The reason that Aconia have decided to use the term non-thermal low-level lasers is because some low-level lasers create a heat exchange or heat event. Aconia's lasers don't do that. Aconia's lasers are totally non-thermal and they're totally low level, so there is no heat event. So that's why we have elected or decided to call them non-thermal. Another interesting part about non-thermal lasers is something I said to you at the beginning. Non-thermal lasers don't have a target. If I'm working in surgery, I can decide that I want to use a thermal laser. I want to cut something under the skin, let's say 2 centimeters down, and I wanted to stop at that point. Because the laser stops at that point, and because of the energy used, this generates thermicity, which has the effect that I want. When I do something with a non-thermal laser, remember what I said at the beginning, we don't have a target. So that energetic beam doesn't have a definite terminal point, which is imposed on a thermal laser. So lasers, as we already said, it's light, it's columnated, it's coherent, it's monochromatic. All of the wavelengths are in phase, and it's a unidirectional beam. Non-thermal low-level lasers do not damage cells. They don't damage tissues, and they don't work as an irritant. In fact, they have the opposite effect. They give cells energy. They create healing. They affect nerve tissue. They affect skin tissue. They affect muscle tissue. They affect vascular tissue. And by doing this, as you'll see if you follow us through this series of lectures, we create healing. We allow the body to restore itself, and we allow rejuvenation to take place. If you're listening to that and you start thinking about it, what I'm saying to you is that our bodies contain everything they need for a happy, healthy life. We are the ultimate pharmacy. Within us, we have everything we need. It's just that as we age and events change, so do the way our cells work. But if you follow us through this series, you'll see how we can affect and change that and put the body into rejuvenation. So hot lasers, they're also coherent, monochromatic columnated waves. They're in phase, and again, a unidirectional beam. However, as we've already said, they generate heat. And that heat damages cells. Because when I'm using it to cut, I'm using it at such a temperature that I'm basically cooking the end of a vein to stop it from bleeding. Or if I'm taking out a verruca, I am burning the life out of it with my laser. I'm vaporizing it. The result of that is scar tissue. And if I didn't get my anesthetic right, considerable pain. So, non-thermal low-level lasers, as we have said, can be compared to any drug. So to understand that, we have to look at drugs in terms of drugs have two things. A drug is a medicine, and the second thing that it has is the amount of times you take that in the day. So when we think about non-thermal low-level lasers as a therapeutic drug, the active ingredient in that, which is the light, is the medicine. And the dose is the amount of time I give to that. And in non-thermal lasers, we don't really worry too much about joules per square centimeter and things like that, because what we're interested in is creating that cellular cascade by allowing cytochrome C to absorb the photonic energy to create the movement and the cellular activity that we need when it comes to allowing this pharmaceutical or this chemical action to work. So lasers in modern therapeutic care. Lasers have been used in medicine really since the 70s, but originally they were pioneered by a guy called Andrei Mester from Semmelweis University in Hungary. And this guy in the mid-60s, I think it was 1965, decided that by accident, he was going to keep some mice warm, that as you do, he'd shaved. I mean, we all like shaving mice. It's probably one of our best hobbies, but this guy shaved the mice. And he decided that having shaved them, he would be kind and he would like to keep them warm while he was going off on his Easter break. So he went hunting for a light source or a heat source, and he found what he thought was a heat lamp, suspended it over his shaved mice, and he put another heat lamp over his mice that he didn't shave, his control group, and he went away for his Easter break. And when he came back, he found that the mice under the laser, not only were they thriving and doing well, they had begun to grow their hair back. So any of you that know me know that I haven't tried it for that yet. But lasers since 1970s, and because of what he did after that, he started working with diabetic wound healing and wound closure infections and things like that. Lasers begin to gain, I suppose, traction within medicine. And within the 1970s, they were still considered to be a little bit alternative. But now pretty much these lasers are mainstream. So why non-thermal low-level lasers? The answer to that lies in research, the research that we know. And over the last 10 years, there has been an extreme amount of research into non-thermal low-level lasers. We have looked at the method of action, we've looked at viability, we've looked at pretty much everything that we can do in terms of how these lasers can be utilized. And we know from the research that mitochondria decrease with age. We're going to get into this a lot more next week, but we know that they decrease with age. And we know from the research again that non-thermal low-level lasers increases the viable number of mitochondria. So when we look at kids herring around like loons and adults not being able to hare around as fast of them, that's because the decrease in mitochondria, the decrease in available energy. So we know that non-thermal low-level laser has a global effect on the body. So if I take the non-thermal low-level laser and I point it at any part of you, let's say we point it at your mid-chest, because of electron transport, that's having a three-dimensional global effect on the entire system, a beneficial effect, increasing the viable number of mitochondria. And as I've said in part 2 of the series, we're going to look at the evidence behind non-thermal low-level laser, and we're going to go more deeply into the cellular, beneficial, and therapeutic activities of laser that we can actually utilize in our clinical practice. So the benefits of applying non-thermal low-level laser, it's quite a mouthful when we stick that non-thermal bit in front of it, but however, these lasers, as we said, they increase the viable number of mitochondria, but primarily mitochondrial DNA and mitochondrial DNA synthesis. We see this upregulation in the interleukin cycle, and we also see stimulation and production of stem cells. Again, next week we're going to see a lot more of this. So ultimately, we can put our bodies into regeneration and restoration. So the benefits of applying this technology to you, your family and clients, even your pets, are you lessen inflammation, you improve function. When we talk about improving function, we all get up sometimes and we've got those aches and pains that we say, oh God, that's just part of age. It doesn't have to be part of age. You can take the laser and you can use it to lessen that event, and in time, the event doesn't happen. So we can use it to upregulate the immune response. So when it comes to the seasonal nasties, the colds, the flus, and all of these things that we all fall subject to, using lasers upregulates the immune response. And for pain, the relief is pretty much instant. Take me back 5 years and a patient comes in with pain. I probably don't even look up at them. I just reach for a prescription pad, scribble something on it, hand it to them, 50 euros, thank you, come back if it doesn't work. Now, I have become a real medic. Now, my patients come in, I look at them, I talk to them, I know who they are. I know who their kids are. I know their pets' names. I now have a relationship with my patients because I don't reach for a prescription pad anymore. I reach for a laser and I interact with my patient. And remember, part of the therapeutic journey that we take our patients on is not just the intervention we make, it's the care, the respect, and the attention that we give them. So these lasers have changed the way that I practice. They've changed the way I look at the world, and they've definitely changed the way I look at my patients. I've suddenly realized that, I am actually a medic. Maybe when you start using them, if you haven't already, you will realize that as well. Other things that they're really excellent at is accelerating healing. I use these before surgery. I have used them when I've been doing reconstructions, when fellas have come off motorbikes. I've used them during surgery, and I definitely use them pretty much immediately after surgery when we've stabilized bleeding. So where can it be used? Already said to you a lot about that, but these lasers can be used in general practice. If you think of your trip to the doctor, I think it would be really nice to have doctors like we had. I grew up in the 70s, and when we went to the doctor, you got a sweet, you got a lollipop. Don't get lollipops anymore because they're in dread they'll be sued because 20 years time they made your teeth fall out. So we can give the general practitioner a new lollipop. It's called a laser. We can use this, as I've already said, in surgical recovery. In the States, it's used extensively in chiropractic medicine. It's used widely in physiotherapy. The place that most comes to mind when I think of using lasers in physiotherapy is a clinic that I often visit in Romania, where they do a lot of very advanced rehabilitation. And since they've started using these lasers, they are as astonished as we are at the potential of what these lasers can do. But why would we be astonished? Because our body is the ultimate pharmacy. We carry it with us every day. Our genome is the map that tells us what our body should and shouldn't have. All the laser does is gives us the energy to make the change. These lasers are frequently used in podiatric medicine, especially in the treatment of dermatophytes such as onychomycosis. They can be used in psoriatic nails. They can be used in fungal nails. They can even be used to restore and rejuvenate nails that have lost their luster and look like the kids have been chewing at the ends of them. But also, by using these lasers in onychomycosis, we have found and researched since that it affects diabetic peripheral neuropathy and allows patients to regain sensation by restimulating nerve growth. These lasers can be used in medical specialties. They can be used in neurology, immunology, gynecology. They can be used pretty much anywhere where you want to activate that human pharmacy. And where would we not want to activate that human pharmacy? We can use them in fat cell management. So that would be body sculpting, it would be diabetes, obesity management. It would basically become weight management because we can use these lasers to emulsify fat and release it into the lymphatic system where it can be taken out through exercise and movement and phagocytosis, and anything left can be returned and restored to the fat cell. Because the World Health Organization told us many years ago that fat cells are part of our endocrine system, and as such, we don't want to damage them. So why would I go doing nasty things to my fat cells when I wouldn't do it to my liver? These lasers basically do no harm, the first rule of medicine. And also these lasers have been and are extensively used in veterinary medicine, and were very much used in veterinary medicine long before they made the jump into human medicine. So instead of having to do a lot of the research on animals that lots of other drugs and medicines do, Lasers already did that, so really, we're ahead of the curve. So contraindications. I would say to you, contraindication for this is photosensitive epilepsy, even though we treat epileptic patients, but in the beginning, photosensitive epilepsy is a contraindication. Active cancers in the past 3 months. The reason for that is some clinicians worry about cellular proliferation because lasers proliferate cells. But from some of the research that's out there at the moment, especially HIV research, we see that lasers proliferate cells that the body recognizes as being normal. And that comes back to basically our genome being the map or the inventory of everything our body contains. But we'll get further into this next week. So in the meantime, active cancers in the past 3 months are a contraindication. And photosensitivity. Some people are sensitive to light, and some people find that light actually causes them damage. So we don't use it there. We have then a number of things that we call advisories, and advisories are areas where we would say, okay, we need to think about whether we're using them or not, especially when it comes to menstruation, because these lasers increase the blood supply. Or the available blood supply to the area. So if we have a client and they're menstruating and they have normal periods, then it's not so much a big deal to say, look, you might get a little bit of an increase. But if we have patients that have things like endometriosis or endometrial issues, then basically we need to think about the application of the laser then, and I wouldn't advise it. Cancer pain. We can treat cancer pain. So if you have these devices or you're thinking of having these devices, excellent for treating cancer pain once as we have trained you correctly in the efficacious use for that. Another thing we have to be aware of is some of our patients will be taking immunosuppressants and they will be taking other drugs for things like rheumatoid arthritis, psoriasis, eczema, all of these immunosuppressant medicines. They may have had a transplant. The advisory is there because it doesn't mean it doesn't work. It just means you're going to need 1 or 2 sessions or 1 or 2 hits more. So when we come to lasers, I'm going to just show you some of the technology that we're talking about. So this is an FX635. It's the new generation model. I use this in my clinic here when we're doing neurological work, when we're treating autism, when we're treating Parkinson's, and when we're treating ADD and Alzheimer's research. This is probably Aconia's flagship. Simon may slap me later, but it's the nail laser for onychomycosis and all the things that I have already mentioned. This is an accelerate, which is used in pain management. It can be used in wound management. It can be used in neurological management, pretty much anywhere where you want to activate that human pharmacy. This is an EVRL, same device, but it has a violet beam also. So the violet beam is 405 nanometers. So just on that visual spectrum and just in the violet spectrum, it's coupled to a 635 nanometer laser, which is at the upper end of the spectrum. The red laser basically improves blood supply, muscle function, nerve function, etc., etc. The violet is antifungal, antimicrobial. But the other thing that it does that's very important is it produces more H2O2 within the system than other lasers. So if we're dealing with, I don't know, seasonal nasties, a viral flu, viral flus cause us a bucket load of issues because they create something called oxidative stress. And oxidative stress happens in the body when suddenly we find that we have got too much reactive oxygen species triggering too much free nitric oxide. And the combination of the two, when the body can't rid itself of it, creates oxidative stress. We'll get into this more next week, but it creates oxidative stress. What this laser does is this laser too will create reactive oxygen species, as with all of these. It will create free nitric oxide, but then the magic bit, it goes on to create H2O2 and flushes all that rubbish from the system. So when it comes to that nasty viral flu or whatever, it's going to help with that. And this gadget is the PL Touch. For a long time, this was the laser that I had a love affair with, because I have yet to find something that it doesn't do. It's very versatile and very adaptable. Now my favorite is the EVRL because of the violet beam, but just my love affair with this went on for a long time. And yes, in terms of love affairs, I am told reliably by colleagues in the States that it will even treat male erectile dysfunction. I will leave it to your imagination as to where you're going to put it. So applications for these devices, we can use these devices pretty much anywhere. So if, for example, we're going to use them in a pain management setting or a dermatological setting, or pretty much anything we want to do with the body, those of you that are listening are chiropractors will see that we have a dermatome chart. So if somebody's presenting with tennis elbow, we're going to go treat, first of all, with the laser, the C-spine dermatome. We are then going to treat the area of the problem, and pretty much the patient will find instant relief. So when you're using these lasers, first rule, dermatome area first. Other areas that we can treat are neurological conditions, neurological functions. In fact, as we go through the series, you'll see more that we can treat a lot of conditions from Achilles tendinopathy, plantar fasciitis, to basically mild respiratory conditions directly through the brain. And when you look at the brain in terms of its areas of functions, if you look at the motor area there, motor movement, that little diagram there tells you what bit of the brain is responsible for what thing. And if we treat the brain that way, then we treat the body also. So that pretty much sums up my presentation. I think Julie is somewhere there listening. So if Julie wants to come back on, we can answer any questions that have presented.
Hi,
Are you
hi
there?
there. Hello.
Hello.
Hello. I don't see any questions as yet. As if anybody's got anything to ask them, just type in the little question box.
So if there aren't any questions, we will do this again next week. Next week is the theory of cellular interaction. I'm going to try and keep all of these lectures down to between half an hour and 40 minutes, because I'm very much aware of the fact that we all have schedules and time, and these things can be boring. So as there are no questions, thank you very much for your time. Thank you very much for listening.